Okay, this is our isometric loading for the external hip rotation. So we're also going to use that 90-90 position as we use on internal. If you remember, we're just going to let the legs turn to where they make a 90-degree and a 90-degree. This time we're going to be using the front leg or the lead leg for our contractions. So setup for this is if I turn my shoulders square forward, I should be able to see that my leg is coming directly off of my body on a straight line, and the lower leg is making that nice 90-degree angle. As we assume this position, I'm going to try to pull my tailbone towards the ceiling. So I'm going to rotate my pelvis just a little bit. And as I lean forward, I'm going to try to keep my sternum nice and tall. So no buckling of the spine. I'm going to stay nice and tall as I push into this position. It shouldn't take much for you to feel the stretch deep in the capsule itself, deep in your hip. Keep in mind, for our protocol, we're going to hold this position for approximately 2 minutes. So if you need to push pause now, so you can stay here for 2 minutes and continue with us in a moment, that's when you want to do that. From here, the protocol is, remember, we're going to use the parts of our leg that are touching the floor first to push down, the parts of the leg that are not touching the floor to pull or contract up as if you're going to lift the leg up. Remember, our contraction protocol is going to be approximately 5 seconds to increase the pressure downward. So I'm going to count on a 20% scale, 2, 4, 6, 8, 10, and then we're going to hold that position for 10 seconds. Let's run through it together. As I increase my pressure downward, I'm at count 1 is 20%, count 2 is 40, 60, 80, and 100%. I'm now pushing down into the floor as hard as I possibly can. I'm going to hold for 10 seconds. At the conclusion of that 10 seconds, we're going to immediately pull the leg up as hard as we can in 3, 2, 1. As I pull up, nothing should move. I should stay in position. The only thing that's happening is this contraction in the top of the leg that I'll hold for 10 seconds. Once I relax, I'll stay in position and continue with the cycle approximately 3 to 5 times total. When you've done that on one side, simply switch the legs. We're now working on the front leg on this side. Hold the position for approximately 2 minutes and repeat the protocol.